On February 15, 1872, a physician stood up and presented a paper before the Meigs and Mason Academy of Medicine in Middleport, Ohio. The paper that he published following this presentation will turn out to be a classic. He described to his audience a neurological disorder which he said was confined to certain, unfortunately, a few families in Long Island, New York. He said it came on gradually in adult or middle life and progressed over years until the hapless sufferer is but a quivering wreck of his former self. He also noted that the sufferers of the disease had a tendency to insanity and suicide, and that it never skips a generation to again manifest in another. In depicting the disease's sad prognosis, he stated that, "I have never known a recovery or even an amelioration of symptoms. When once it begins, it clings to the bitter end. No treatment seems to be of any avail. It seems at least to be one of the incurables." The man's name is George Huntington, and he was describing the first published case of a relentless movement disorder that will come to bear his name. Hello, I'm Ibrahim Imam, and welcome to this episode of the Neurology Lounge podcast. It is titled Chaos, the Disrupted Choreography of Huntington's Disease. The above account of the disease was narrated by Peter Harper in the book titled, appropriately, Huntington's Disease. Harper wrote that George Huntington had an impressive medical degree, both his father and grandfather being physicians. Indeed, his first exposure to the cases of chorea he described was when he accompanied his father on one of his medical visits in Long Island. Huntington had written about how he first came to know of the disease. He said, "Driving with my father through a wooded road, we suddenly came upon two women, mother and daughter, both tall, twisting, grimacing." In his book titled Genome, Matt Ridley wrote that the Long Island pedigree descended from two brothers who emigrated from Suffolk, that's in England, in 1630. It is disheartening that several of their descendants were burnt as witches in Salem in 1693, possibly because of the alarming nature of the disease, according to Ridley. The strong family association of Huntington's disease is portrayed by Melanie Pearson in her memoir titled Somebody Up There Likes Me. Chronicling how Huntington's disease crept into her family through her maternal line, she traced its first manifestation to her grandmother, who, she said, had a tendency to suddenly cook up mad grudges from out of the blue. She was also known for what she said were her frequent bouts of odd behavior and a particular brand of temper tantrums. It was, however, her own mother who manifested the most evident features of the disease. Starting with what she called a compulsive twitch, Pearson wrote of how her mother went on to become nervous and jumpy and to have a jittery fidget which got progressively worse. And then her mother started displaying psychiatric symptoms. She started having paranoid and obsessional thoughts, and she began to exhibit episodes of alarming, sudden furies when the most trivial thing could blow up into something huge and significant. During these periods of rage, her mother would also engage in screaming rows. Pearson's mother was eventually diagnosed with Huntington's disease after she underwent brain scans and a series of blood investigations, and this included a genetic test. Pearson's narrative also graphically illustrated the impact that the knowledge of the hereditary nature of Huntington's disease has on family members. For example, she wrote that as you watch your parent slowly deteriorate and die, you know that this may be your fate too, as fickle as the toss of a coin. She likened the ever-present threat of inheriting the disease to a roulette wheel in which, she said, generations of the same family are destined to relive the same thing, like an endless nightmare with no reprieve. Although Pearson later confirmed that she had dodged the lottery of inheriting the disease, her brother Nick did not evade what she called the genetic baton. But although she evaded the fate of the disease, she nevertheless bore the brunt of witnessing and sharing in her brother's relentless illness journey. The sad impact of Huntington's disease on individuals is also demonstrated by the case of the American folk singer Woody Guthrie. Harper wrote of how the celebrity first manifested symptoms of the disease around 1952 when he was only 40 years old, and he wrote of how he struggled with it for 15 years until he died in 1967 when he was only 55. Guthrie had inherited the disease from his mother, and he developed such symptoms as paranoia and aggression. Indeed, the psychiatric manifestations of Huntington's disease are some of the most disabling features of the illness, and they include personality change, apathy, anxiety, depression, obsessive-compulsive behaviors, disinhibition, delusions, and psychosis. So significant were the psychiatric symptoms that Guthrie demonstrated, he eventually became confined in hospital because of them. Although his wife Marjorie divorced him on the advice of his doctors, she remained committed to him to the end. In the same year he died, she set up the Committee to Combat Huntington's Disease, CCHD. The disconcerting picture of how Huntington's disease affects individuals and their families was also vividly portrayed by Sandy Sulaiman in her touching memoir titled Learning to Live with Huntington's Disease. A 47-year-old trained journalist at the time of writing, Sulaiman narrated her family's odyssey with Huntington's disease in very graphic forms. She described how the illness can seem like a juggernaut plowing through the family, so massively, awesomely unstoppable that each family member ends up almost paralyzed by it. She also wrote of how the impact of the disease, or of what she called its possible future impact on themselves and on the people they love, can cow them and make them feel powerless to do anything. Sulaiman was 30 years old when her father phoned to tell her he had been diagnosed with a possible hereditary cerebellar ataxia that had left him confined to a wheelchair. It was years later that the correct diagnosis of Huntington's disease was made, a revelation that she said left her and her husband Phil reeling for months. She described how her father, also a journalist, had a changed personality around the time he himself was 30, transforming from someone who was kind, loving, funny, creative, enthusiastic, slightly madcap, endlessly interested in everything, curious, articulate, charming, and very clever, and how he became someone who was monstrous, violent, abusive, selfish, unreliable, and erratic at work. Apart from becoming a bullying husband and father, he had also been sacked from countless jobs. It was sad that her father eventually attempted suicide by taking an overdose of paracetamol, and he was eventually committed to a psychiatric ward. It was while she herself was giving a presentation as part of her training to be a lecturer in journalism that she said, "My tutor pulled me aside and pointed out to me that I shouldn't wear bracelets because my movements made them jangle and create too much noise." She said, "I was devastated as I had not noticed any symptoms myself." She consulted a blunt, cold, and clinical neurologist who examined her and requested the genetic test, which unfortunately confirmed that she had the disease. She was 41 years old and had lived with the knowledge that she carried the risk for 7 years by then. Whilst her brother Jeff also inherited the disease from their father, her sister Wendy did not. The family tree she drew showed that the origin of the disease was her paternal grandfather, Alfred. Exploring the family flow of the disease, Sulaiman also explained that each of her two sons, Bromley aged 25 and Danny aged 15, had a 50% risk of inheriting the disease from her and perhaps manifesting it by the time they were in their own 30s. In describing the full panoply of clinical manifestations of Huntington's, Sulaiman emphasized that involuntary movements are just one of the symptoms of the illness. Amongst her early distressing symptoms was impairment of memory, and she illustrated this when she said, "When I'm tired, I forget words in the middle of sentences." She also started forgetting little details and getting lost when driving. Huntington's disease also affected her balance and her coordination. Clumsiness meant she was always dropping and breaking things, including whilst shopping, embarrassingly. Her handwriting also deteriorated to the extent that she couldn't read what she had written. She consequently had to stop cooking, ironing, and all other housework. She also wrote of how the disease impacted her occupation. She said, "After I was diagnosed with Huntington's, I continued to write a few articles, but I found the ability to carry on writing to the degree I'd done before increasingly hard to maintain." She admitted that Huntington's pretty much ended my writing career. Beyond the psychiatric features, people with the disease also often manifest with cognitive impairments like executive dysfunction, perseveration, impulsivity, distractibility, and lack of insight. And apart from chorea, Huntington's disease can also manifest with a bewildering array of other movement disorders, and these include myoclonus, dystonia, rigidity, bruxism, which is teeth grinding, and a lot of eye movement disorders. Although it was clear from the start that Huntington's disease is a strongly hereditary disorder, the search for the genetic cause took a long and convoluted course. And the one name that stands out in this hunt is Nancy Wexler. Nancy Wexler was the daughter of Dr. Milton Wexler, a psychiatrist who had set up the Hereditary Disease Foundation after his wife developed the disease. A trained psychologist, Nancy Wexler took over the running of the foundation on her father's death. And what she set out to achieve was to determine the genetic underpinnings of the disease that had wreaked havoc on her family. To do this, Wexler turned her attention in 1979 to several villages around Lake Maracaibo in Venezuela, where about 10,000 people with or linked to people with Huntington's disease lived. Wexler herself personally visited 3 Venezuelan villages, Sandui, Barranquitas, and Laguneta. The Wexler's efforts bore fruit when she successfully traced the Venezuelan family tree to Maria Concepcion, a woman who had 11,000 descendants in 8 generations, of which at least 371 had developed the disease. The Huntington disease gene was eventually isolated in 1993 by Canadian James Jusella of Massachusetts General Hospital. Jusella located the gene on the short arm of chromosome 4, making this the first time ever that a disease-associated gene was linked to a human chromosome. Sequencing the gene, however, took another 10 years, what Andrew Pickens referred to in his book A History of the Brain as the longest and most frustrating search in the annals of molecular biology. The feat was accomplished in 1993 by more than 50 investigators working in 10 research institutions, and it showed that the Huntington's disease gene has 300,000 base pairs. Although Huntington's disease is typically late onset, it can unfortunately manifest at younger ages because it has this characteristic phenomenon called anticipation. Genetic anticipation is when the length of a genetic anomaly increases with succeeding generations of a family. and this successive increase in length translates into a progressively younger age of onset of the disease with subsequent progeny. Therefore, as more generations of the same family arise, the disease will eventually manifest as juvenile Huntington's disease. This is when the symptoms of the disease start before the age of 21 years. A genetic test to confirm the diagnosis is recommended partly to exclude the endless list of disorders that can mimic Huntington's. These neurodegenerative disorders constitute a long list which include spinocerebellar ataxia, benign hereditary chorea, Wilson's disease, Friedreich's ataxia, and something called ataxia with oculomotor apraxia. You probably don't want to know the details of these differentials, but these are the things that the neurologist would need to rule out when considering the possibility of Huntington's disease. Other tests are also often undertaken to investigate other causes of chorea. And among the long list of neurological causes are infections such as HIV and CJD, and also focal brain disorders like MS, stroke, tumors, and even traumatic brain injury. There's also an equally long list of systemic causes of chorea, which include autoimmune disorders like Sydenham's chorea, systemic lupus erythematosus, Sjogren's syndrome, and the antiphospholipid antibody syndrome. And on top of that is a long list of endocrine diseases that can manifest with chorea, and these include diabetes, thyrotoxicosis, hyperparathyroidism, and hyponatremia or low sodium. Many medications may also have chorea as an adverse effect, and these include the oral contraceptives, L-Dopa, valproate, steroids, and lithium. Suffice it to say that this is far from a complete list of mimics. The ultimate test for Huntington's disease is the genetic test. Being tested for any genetic disease is nerve-wracking, and this is perhaps not more so than testing for the risk of developing the dreaded Huntington's disease. The emotional and psychological turmoil of undergoing a genetic test for this disease was hauntingly depicted by Erin Paterson in her illness memoir titled All Good Things. In her case, Huntington's disease first reared its head in her family through her grandmother, who, before her death at the age of 72, had developed what she called a stilted gait, and her arms twitched back and forth randomly. She had also become very angry and self-centered and had a lack of sympathy for others, even her closest family. At the time, her parents had speculated that her grandmother had a genetic disease and that it may be Huntington's. And this was eventually confirmed when the genetic test for the disease became available after her grandmother had died, but she had had a blood sample given for research, and this was what was tested. Paterson described in intricate detail her thought processes as she contemplated taking the test herself. She wrote that the question remained unanswered. Do I want to get tested for HD? She said, if I decided not to get tested, would I be able to live with the uncertainty of not knowing? Or would I spend my life looking for signs of the disease, every random twitch of my finger, every forgetful moment setting off anxiety? I could spend my life worrying about something that might never happen. But then she also thought, if I decided I did want to get tested, then would I know for sure? And she considered the implications of having a positive test when she asked herself whether it was morally correct for me to have children when I knew there was a 50% chance of passing a horrible disease onto them. Paterson was also concerned about how having a positive genetic test will impact her relationships. For example, she wondered if her husband, Daniel, would still love and support her no matter what happened, or if, on the other hand, he couldn't handle it and wanted to find a better wife. Paterson also feared that a positive test would make her friends value her less as a person and they wouldn't want to be friends with someone who was going to lose her mind. After eventually deciding to take the test, Paterson went through pre-test genetic counseling, and she then had to endure what she said was the tortuous wait for the result, which was unfortunately positive in her case. She said she was in shock and numb, and that her head was swirling with a million different scenarios. Daniel walking out on me, my hands shaking, losing my mind. She said, I felt like I needed to ask questions, but I had no idea what to say. I'm not prepared for this, my internal voice screamed. Sadly, there is no cure for Huntington's disease yet. The treatments of Huntington's disease therefore rely on the management of its diverse symptoms. For example, the treatments of chorea include amantadine, tetrabenazine, deutetrabenazine, risperidone, olanzapine, and deep brain stimulation. How then does anyone come to terms with a diagnosis as grievous and incurable as Huntington's disease and still manage to live a normal life? Paterson's story is a perfect example of the way many people diagnosed with the disease take stock and persevere, as encapsulated in her remark when she said, she made a conscious decision not to let my diagnosis ruin me. She admitted that what I once imagined as my vibrant future had suddenly been shadowed by disease and suffering, and she had started viewing the onset of her disease as the end of her time as a valuable member of society. She nevertheless wrote that the diagnosis gave her life an urgency which she said she had never felt before, a pressure to reorganize all her dreams and goals into a shorter time frame while she was still healthy. It is in this context that she said, slowly I inched myself closer to the happiness I recalled existing in my life. I started to see that I still had a future, even if it wasn't exactly the one I had grown up imagining. To further explore the patient perspective and the clinical management of Huntington's disease, I will be speaking to physician Thomas Bird, author of the memoir titled, Can You Help Me? And this will be in the next episode of the Neurology Lounge podcast. Thank you so much for listening to or watching this podcast, in which we started our exploration of Huntington's disease. If you found this podcast enlightening, you might consider subscribing to my checklist website called NeuroChecklist, and also perhaps exploring my book titled Surfing the Brain. And why not subscribe to the podcast, iTunes, Spotify, or YouTube channels to ensure you do not miss the next episode of this theme in conversation with Thomas Bird. Thank you very much, and join me then.